Hmm. Hello, Anthony. It's Tulio. Great post. I'm gonna go ahead and get straight into it. Just a quick shot back on your post. You talked about the percentage of people that are on welfare or below, at or below the poverty level. That's a pretty significant number for the U.S. A large country with a lot of money, superpower world in the world. Um, but that's what the numbers are. So apparently, I like your assessment that you made towards the end of your post that policy making or policy analysis currently is not working. Whatever's in place, from the TANF you mentioned, temporary aid needed for the family, all welfare programs. Um, the welfare reform program that they in place, with Clinton and Obama, it probably needs to be re-looked at, revamped somehow. Um, so with the you mentioned the cost of living allowance, you made a comparison of two states. I believe that the cost of living for each state is different. I was trying to research that, but I believe it's different. So since the welfare program is ran by the states but funded by the federal government, based on population and state needs, I believe each state has a different poverty level or cost of living standard that they go by. Um, so along those same lines, you mentioned tax. We see it at the end of every month, just like you mentioned. Some states tax more than others. I've lived in about 7 different states for quite a while, so I've paid some. North Carolina was probably the one place, and Virginia, that taxed me the most. There's other places like Texas, maybe Florida, Nevada, that don't tax as much. So I guess it depends on what the economy looks like for the state and how much funding they're trying to get, not only for their programs that they support through welfare, but other programs, schools, housing, education, stuff like that. So I think those two things that you made, comparisons, are very legit, very valid. It just depends on where you're at as far as states and how they're going to support the program. And cost of living, I believe, is different for each state. So the temporary aid for needy family, you mentioned that the program is meant to be for families to become self-sufficient, reduce dependency on the program. But it is hard to become eligible to apply for the program to get some cash assistance. So a lot of families do end up on food stamps, like you mentioned. I think you said 1 out of 6, or about 50 million families are supported or provide or need food stamps. I think some things that contribute to that, and you mentioned it also, is the minimum wage standard. Um, the federal government has set standards for the minimum wage. Some states are actually higher than others. They go above the federal government minimum wage standard. A lot of families with that set standard in certain states just cannot sustain themselves. So that's why they're at that poverty line, at or below, because the minimum wage would not, those corporations would not pay them more, so they can sustain and live comfortably, able to sustain their families. The other one is jobs. I think jobs is one of the biggest contributors. There's cities out there, there's states that just don't have jobs. So, and families are not able to relocate. They just don't have the money to do that. You would have to buy housing, not only that, but find a job. So, and the other one I believe is healthcare. With the new Obamacare healthcare program, I don't know if it's going to contribute more personnel to the welfare program or it's going to remove people from the welfare program. We just have to see, the efficiency of that program, of the Obamacare. So those three things contribute a lot to the welfare program. Minimum wage standards, temporary jobs because there is no jobs to find. There's unemployment is very high, and the healthcare program. You either got to buy some healthcare now to provide for your family, or not buy any at all and then go feed your family. And now with the Obamacare, they're going to have some penalties you got to pay. With the TANF program you mentioned, there's a limit on it, like 5 years. There's some provisions. Single parents have to earn so much. There's minimum wage you got to earn. You got to try to locate jobs. You got to try to get some adequate training in job skills and also some education. But I also find it that when you try to look for a job, there's no jobs. How are you going to be able to get yourself out of that cash assistance? It's very difficult. And even many people, when they find jobs, it's only temporary. And sometimes they don't provide you with health care. So then you go right back to that system, the cash assistance. So people go out of it and then they go right back into it just because of the way the environment is. And it may not be like that in some states, and some states are worse than others, but it all depends on the economy of that state. So that's why people keep jumping in and on. You also mentioned the stigma in the U.S. With the population. I think a lot of people look at that as a bad thing, but it's really meant for needy people. I mean, over the ages, that's why it was created. But unfortunately, there are families out there. There's individuals that take advantage of it. I mean, I saw it coming up in the big city like Los Angeles. You could see where people were abusing the system, and others really in need. It just wasn't enough. So there's an imbalance. I don't think it's equitable, even though there's some provisions in there to try to identify people to make sure they use the program accurately. But how are you going to enforce it, other than trying to make them get a job, some education, some skills? So you mentioned the threshold requirement. Is it effective? The means, is means tested? May be effective, may not be, but how are you going to enforce it? That's the big part of it. So you mentioned that reducing the poverty in the U.S., these welfare programs and reforms are not working. Policy does need to be changing. Analyzing the welfare program is not effective. It's something that is required by people, by needy family, especially elderly, kids. For example, like school lunch programs, the the Social Security falls under the welfare, so that's needed for the elderly as they become older and they can't work, and they need some money to sustain them. But some things that probably should be looked at, I will say, is look at the unemployment, Department of Labor. How are you going to provide more work for people that are in the welfare program? Also look at it, just like you say, by state, by regions and cities. See which ones are affected the worst. Is the money being positioned correctly? Are the right people being identified? So those are all good things that you mentioned. I completely agree with you. Somehow the program needs to be reformed. Great posts, and thanks. And I am out.